Hello, my name is Michael Rangel, and I will be presenting the topic of medical tourism. Medical tourism is the practice of having medical procedures done in a foreign country as an alternative to using their country's healthcare system. Medical tourism has become a multi-billion-dollar industry since the early 2000s, facilitated by the speed and relative affordability of international travel. The practice of seeking foreign medical operations has risen over the last few years with treatments that range from life-saving procedures to minor cosmetic surgeries. There are many reasons that one might seek to make use of medical tourism, such as saving money, being able to hide that a procedure has taken place, and to circumvent their need for a waiting list. Medical tourism is a practice that saves the lives of many people. Medical tourism is when people elect to use foreign healthcare to receive medical treatments as opposed to their local healthcare systems. Some of the treatments that people look to receive are elective procedures, as well as complex specialized surgeries like knee and hip joint replacements, cardiac surgery, dental surgery, and cosmetic surgeries. People who are struggling financially can often receive the medical procedure they need at a significantly lower price in foreign markets. Medical tourism can be used to help those who are uninsured or whose insurers will not cover the cost of the procedure. Some motivating factors for the use of medical tourism is the cost of procedures, waiting time, and the ease of travel. To give an idea of the difference of cost, a heart surgery in America can cost around $100,000, while the same procedure in India will cost around $12,000, with travel expenses adding a negligible increase of cost. American patients can typically save between 15 to 85% of their medical bill by making use of medical tourism. While countries like Canada and Great Britain have free government-run healthcare, some patients must wait years to receive their procedures or even die before getting on the operating room table. Travel agencies have even taken to creating travel packages that take care of everything that patients will need during their stay. An additional benefit of medical tourism is that virtually every type of medical procedure is available abroad. This means that procedures can be planned for destinations that specialize in what procedure that the patient is looking for. Some examples of this is that India specializes in cardiovascular care, Costa Rica specializes in dentistry, and South Korea specializes in oncology, which will help the overall level of healthcare the patients can look to find outside of their resident country. Some arguments used against the use of medical tourism are that it draws money from the local economy, and that locals are being negatively impacted by doctors who cater to foreign needs and increase the cost of treatment for them. Another argument is that there is no way to check that the doctor knows what they are doing and that their credentials are legitimate. Less developed countries tend to have smaller, if any, regulatory body to oversee medical procedures and practitioners. People also worry about dying on the operating table, either due to a surgical mistake or an after effect of a surgery. There is also the worry that unproven medical procedures are being done and they have no proven effectiveness or are still being researched. And there is also the belief that doctors and nurses who cannot speak the language of patients can cause undue mistakes. While the cost of medical treatments may rise, those who work in medical clinics will spend the money they earn in the local economy, which means that medical tourism will slowly help the economy of where their clinics are located. Credentials of doctors can typically be found online. These practices receive accreditations by organizations such as the JCI and the ISO, which assures patients that the facility meets standards comparable to those in the United States. Just because a country is seen as undeveloped does not mean that the quality of care is any worse. For example, the success of cardiac bypass operations in India is 98.7%, compared to 97.5% in the United States. In relation to unproven procedures, there's a degree of research that should be investigated by the patient. When opting to do experimental procedures, one is responsible for themselves to seek professional opinions and not rush to have a procedure done. It is advised that when traveling to foreign treatment, if you go to a country where you do not speak the language, determine ahead of time how you will communicate with your doctor and other people who are caring for you. In conclusion, medical tourism saves those who are short on money or short on time. Medical tourism has become a prevalent part of the healthcare system and is likely to continue growing. Tourism of this kind shares many of the same risks that one might find in their home country. And while medical tourism has controversies within it, many of them can be countered by research into where you are traveling. Medical tourism has helped save many lives which otherwise would have been snuffed out by illness.